Hey folks, back again here, Dr. J and Dr. Nick from Elevation Spine. What we want to talk about today is carpal tunnel. Now, very frequently we hear patients come into our office and say, I have carpal tunnel. See, healthcare is just like the rest of society. Trends happen, right? As things trend, they become more talked about, and then pretty soon we start to identify things in these trends that we think fit with the trend. Carpal tunnel is no different. It's not as bad now, but there was about a 10-year span in my career where all the time I'd have patients come in and say they have carpal tunnel, because there's lots of things that can appear to be carpal tunnel. So first of all, let me have Dr. J explain what carpal tunnel really is, and then we'll talk about the things that can confuse you and appear to be what they're not, and some testing we'll talk about for how to differentiate.
Yeah, so carpal tunnel, the reason it's called a tunnel syndrome, right, is the wrist has a whole bunch of bones in it, right? It's this really weird structure with a whole bunch of different small bones that are linked together with ligaments and basically the tendons of your forearm acting on them. Now, you've got a couple tunnels that lead into the hand, and they're literally tunnels between these bones and between those ligaments. Now, the median nerve is a nerve that really activates kind of these fingers here. It's responsible for a couple different hand motions. You'll notice that a lot of people with carpal tunnel typing, right? So a lot of the fine motor finger movements are basically, I don't want to say activated by the median nerve, but they're really innervated by the median nerve. And that runs right through what we call the carpal tunnel. Now, certain positions place a lot of stress on that tunneled structure. And as it starts to shrink, or stenose as we would say, you basically get a lot of pressure on that nerve. And that'll cause a lot of pain in the hand, can cause numbness, tingling, weakness in the fingers. But also you'll notice that certain motions become almost impossible. If you compress a nerve, even if you just squeeze on it with your hand, you'll notice that it's harder to open your hand, it's harder to flex your fingers. Now that's actual carpal tunnel. But as Dr. Nick said, we do have a lot of people that come in with carpal tunnel, but they don't have it, right? It's caused from something else, like a nerve root problem or something going on in the neck. So I'll pass it off to you for that.
Yeah, postural problems and neck problems can mimic carpal tunnel, because if you get a problem in your lower neck that's affecting your disc, it can actually send numbness, tingling, pins and needles, pain down into your arm and hand. And so of course people pick up, everybody likes the WebMD. People go, oh, I've got carpal tunnel because this kind of looks like it. So it's important to differentiate that. I would say, in my sort of loose estimation, probably 95% of patients that come in and say they have carpal tunnel don't actually have carpal tunnel. They have something that's kind of a copycat crime. And so the way to differentiate that is the gold standard, and I don't believe it's changed, is nerve conduction velocity, where they literally stick needles, EMG needles, along the distribution of the nerve. They fire an electrical impulse, and the specialist will measure how fast that impulse gets down to the end area. So that's really the gold standard to determine. The truth is, though, you probably don't even need to do that. A good clinician with an exam and a history can pretty quickly discern, do you or do you not have carpal tunnel? I bet you don't. You could, and if you do, we'll tell you. But if you don't, we're going to tell you that too. And the good news is these things are something that we treat all the time. Now, one of the risks, who's more at risk for carpal tunnel, Dr. J, men or women?
Women.
Women are more at risk for carpal tunnel, and pregnancy is a risk factor. We find that women can get transient carpal tunnel syndrome related to fluid volume secondary to pregnancy. So lots of things to consider. We love talking about this stuff. We get super excited. We're totally nerds in this world. And please don't take this as medical advice, though. Remember, this is educational and hopefully entertainment purposes only.